Hey there, this is your NCLEX study expert, and today we are going to look at the NCLEX 2025 Top 5 Strategies to Eliminate Wrong Options in NCLEX ARN Questions. The question and answer, correct answer, all the wrong answers and how to apply this to your studying are going to be provided. Strategy 1. Avoid choosing wait and reassess options. In NCLEX questions, options that suggest delaying action, such as wait and reassess, are often incorrect. The exam typically prioritizes interventions that lead to prompt diagnosis or treatment. While obtaining vital signs is essential, it may not always be the immediate priority if it doesn't directly address the patient's current critical need. Example scenario. A client with a history of diabetes presents with confusion and diaphoresis sweating. The nurse suspects hypoglycemia. The appropriate immediate action is to check the client's blood glucose level to confirm hypoglycemia and administer glucose if necessary. Simply obtaining a set of vital signs, while important, would not promptly address the suspected hypoglycemia. Question. A client with a history of diabetes presents with confusion and diaphoresis. The nurse suspects hypoglycemia. What is the nurse's immediate action? Answer options. A. Obtain a full set of vital signs. B. Check the client's blood glucose level. C. Notify the healthcare provider. D. Administer the client's scheduled insulin dose. Correct answer. B. Check the client's blood glucose level. Key takeaway. When answering NCLEX questions, be cautious of options that involve passive monitoring without immediate intervention. Focus on actions that lead to rapid assessment, diagnosis, or treatment to ensure patient safety and effective care. Tip for answering NCLEX questions. When you encounter answer choices that begin with action verbs like obtain, provide, perform, or reduce, followed by an independent nursing intervention, critically assess whether the action leads to immediate and effective patient care. If the action delays necessary treatment or does not directly address the patient's urgent needs, it is likely not the best choice. By applying this strategy, you can enhance your ability to select the most appropriate interventions in NCLEX questions, thereby improving patient outcomes and demonstrating sound clinical judgment. Strategy number 2. Reject outdated practice. The NCLEX is designed to test current, evidence-based nursing practices. Outdated practices can lead to incorrect answers on the exam. It's crucial to rely on updated guidelines from sources like the American Nurses Association (ANA), Centers for Disease Control and Prevention (CDC), and current NCLEX test plans. Example: a nurse is caring for a post-operative patient and is considering the best method for preventing deep vein thrombosis (DVT). Question: which intervention is most appropriate to prevent DVT in a post-operative patient? A. Encourage bed rest for 24-48 hours. B. Apply warm compresses to the legs. C. Encourage early ambulation and use of sequential compression devices (SCDS). D. Massage the legs frequently to promote circulation. Incorrect answer. C. Encourage early ambulation and use of sequential compression devices (SCDS). Why? Early ambulation is a well-established, evidence-based practice to prevent DVT. SCDS help promote circulation and prevent clot formation. Options A, B, and D are old news. Bed rest isn't recommended anymore, warm compresses won't help prevent DVT, and massaging your legs could actually push a clot loose and cause serious trouble. By rejecting outdated practices and focusing on current, evidence-based guidelines, you can improve your NCLEX performance and clinical decision-making. Strategy number 3. Avoid unnecessary treatments. If an order or treatment doesn't align with the diagnosis or could harm the patient, it's likely incorrect. Always prioritize patient safety and question anything that seems inappropriate. Example: a patient with chronic kidney disease (CKD) has a physician order for 4 normal saline at 150 milliliters per hour. What should the nurse do? A. Start the 4 as ordered. B. Question the order due to fluid overload risk. C. Administer half the ordered rate. D. Encourage the patient to drink more fluids instead. Correct answer. B. Question the order due to fluid overload risk. Why? Patients with CKD cannot excrete excess fluids efficiently, increasing the risk of pulmonary edema and hypertension. High for fluid rates can be dangerous in CKD, and fluid intake should be carefully regulated. Always think critically. If an order doesn't make sense based on the patient's condition, question it. Strategy number 4. Avoid forced cursory measures. NCLEX time-based questions test precise calculations. There's no best answer, just right or wrong. Be cautious with rate-based calculations, IV drips, medication timing. Use the on-screen calculator. Don't rely on mental math. Watch out for distractors. Answers may be close but incorrect. Always double-check your work. Example: a medication is infused at 30 milliliters per hour. How long will 150 milliliters take to infuse? A 4 hours, B 5 hours, C 6 hours, D 7 hours. Correct answer: B 15030 equals 5 hours. Tip: show your work. Avoid guessing. Precision matters on the NCLEX. Strategy number 5. Eliminate ambiguous or confusing language. Read the question carefully. Don't rush. Identify keywords and focus on what's really being asked. Isolate subject from verb to simplify the question. Reword tricky phrasing in your mind for clarity. Example: a patient with COPD is receiving oxygen at 6 liters per minute via nasal cannula. What is the priority action? Focus: high oxygen in COPD can suppress breathing. Answer: reduce O2 flow and monitor respiratory status. Tip: if a question feels confusing, break it down. Clarity leads to correct answer. I hope this video was helpful. If you found value in this, please share with your classmates and friends in nursing school. Leave a comment below and like and subscribe so you don't miss out on any of my videos. I'll see you next time.